I wouldn't help but find myself, the IC turned sort of health man, getting quite excited. But because I'm sure that you delve into the golden nuggets of UHC, let me just focus on the technology significance today, and I'll keep it, sir, very brief. Your Excellency, at our core is the hunger to access healthcare legally, history, and securely. Each one of us has dreamt of the day when we can casually walk into a public hospital, be warmly received and treated, medicated, that is tamper-proof from being a counterfeit that has expired. We have prayed for the day that we will never have to worry about innocently undergoing testing, misdiagnosis, and even profit-making medical surgeries fraudulently designed at the altar of our lives. This has harmed the Kenyan public and its faith in our public health institutions. It's been driven by greed, sir, and characterized and categorized by the loopholes in our health system. Today, with the launch of bioregistration of NHIF, we will be making a milestone leap into eliminating this problem. The use of biometric technology in healthcare will ensure that we authenticate patient identity prior to treatment, and through this simple act alone, we will drastically reduce fraud in health insurance, reduce the cost in maintenance, and importantly, improve the management of treatment. As we advance into digitization of our health sector, it will also prove invaluable in cases where we have patients in remote regions requiring treatment. They can simply upload their latest record instantly, enabling doctors elsewhere to examine them at their location. And with this improved efficiency, we can channel the cost of savings to even more Kenyans who were previously uninsured or underinsured. Your Excellency, today is not a day for us to talk so much. We did that over the last 2 days. But Your Excellency, I want to take this opportunity to also thank the health team that is here. And I would like to request people from the Ministry of Health to please stand up. Watu wa afya, Wizara ya Afya, please give them a lot of applause. Because they have sat days, nights to ensure, please sit down, please, to ensure that we are where we are. I also said yesterday, and I want to close by repeating this, Your Excellency. This is not the end of something. This is the beginning of something. We have a newborn in town, and this newborn will have teething issues. We'll expect some challenges, but unless we begin the journey, we will never overcome challenges because they won't be there. So we need to begin this journey and address the issues as they come. We have agreed with the chair of the Council of Governors, Governor Oparanya, that as these things come, we will also cooperate and coordinate our activities. Also, Your Excellency, we recognize the role that we have attached to the governors and also the CECs for health who are here present, because they have spent 2 days in this institution. And if they are here, I would request the CECs who are here, CECs for health, if there are any who are here, please stand up. Please, let's give them a lot of applause also, because they have really diligently worked with us. And we have adopted a way forward on how we are going to work with them. Your Excellency, you are the foremost committed health worker in this country. And therefore, allow me, sir, if I may, just tell one story and then invite you. On one of the nights, I was having an evening out. At that time, sir, we had not identified the Kagwe Special, which is 1 beer and 2 sausages. So on that day, I had 2 beers and 1 sausage. But Your Excellency, in the course of doing so, I heard policemen talking. And they were talking about you, Your Excellency, how you were at a place called Mukuru Wajenga, Mukuru kwa Ruben, Korogosho, wherever. And I want to tell you people, His Excellency called me that evening, and that's why I'm saying, Your Excellency, you allow me to tell this little secret. He called me that evening at night and says, Mutahi, I am in Mukuru kwa Ruben. And do you know that in this area, in this slum area, there is only one little bed with 5 hospitals. We have to do something about this. And because of that conversation, Your Excellency, the next day we met with you, and as we speak today, there are 19 hospitals that are being built in Nairobi City. 2 level 2 and level 3 hospitals in every densely populated area, and another 5 hospitals that we are completing that have not been completed. Mama Lucy Hospital, we are completing Korogosho Hospital, and all the other hospitals, Your Excellency, that you directed. And I want to thank you, because it is that commitment, is your personal involvement and personal commitment that is changing the face of health in this country. Your Excellency, after that little story, can I take this opportunity and ask you, our good friends, to rise up and welcome His Excellency. Karibu sana, Your Excellency. Welcome.
Asante Mutahi, please be seated. Thank you very much. Good afternoon, everybody. So the Chair of the Council of Governors, Governor Wycliffe Oparanya, our host Governor, Governor Ali Hassan Joho, all governors in attendance, cabinet secretaries, principal secretaries, representatives of our development partners, all invited guests. Let me say how happy I am to join you at this occasion of the launch of the biometric registration for universal health coverage, which scheme will be managed under the National Hospital Insurance Fund. Indeed, as Kenya and the world grapple with the challenges arising from the novel COVID-19 disease, today's launch represents a new frontier in our nation's fight against both emerging and long-standing healthcare threats. It is also evidence of the fruitful and dynamic cooperation between our 2 tiers of government as the national and county governments jointly deliver on the shared mandate for the provision of healthcare services. Ladies and gentlemen, the quest for a healthier Kenya has been a central theme of our social contract and public life since independence. Indeed, our current constitution makes it clear on this matter that every Kenyan has the right to the highest attainable standard of health and the right to healthcare services, including emergency medical treatment. To actualize that promise in our Constitution for better health care services, as a government, we have articulated for implementation specific policy measures in such plans as our National Vision 2030 and the Kenya Health Policy 2014 to 2030, as well as the Big Four agenda. The underlying reason for prioritizing healthcare provision is the recognition of the fact that without improving standards of health, our quest for prosperity and a better life for our people would remain hollow. A healthy population means, other things being equal, higher productivity. On universal health coverage, my goal is to ensure that all persons resident in Kenya have access to the essential health services they need for their health and well-being and at affordable prices. There is no doubt, if we look back to the days we were getting our independence, we can say that we have made significant improvements in our health delivery systems. Equally true, however, access to health care is still a challenge for many, with out-of-pocket expenditures remaining high. Available statistics show that in the year 2018, over 1 million Kenyans were impoverished due to high health expenditures for themselves or for their loved ones. Recognizing these unfortunate circumstances, we as a government have prioritized UHC and developed a comprehensive plan to progressively roll it out and upscale it. We began the UHC journey with a waiver of user fees in lower level facilities, then introduced several government-sponsored insurance programs for the elderly, vulnerable children, people living with severe disability, pregnant women, secondary school learners, among others. We then in Kisumu launched the UHC pilot phase in 4 counties, and today we are launching the biometric registration of the state-funded UHC scheme beneficiaries as we progress further along the path of universal health coverage. Ladies and gentlemen, the UHC pilot phase was by all means a success story. It led to an increase in the utilization of health services with over 1.6 million additional hospital visits made during the 12-month period of the UHC pilot phase. Key achievements of this phase include the establishment of an additional 208 community health units staffed by 7,700 community health workers or health volunteers. And these volunteers attended to over 2 million clients, many of whom were served in their homes rather than having to travel to health centers. Further, there was a recruitment of an additional 752 health workers to narrow existing gaps. Ladies and gentlemen, there were important lessons learned in the process of implementing the UHC pilot phase. Lessons which we need to take into account as we scale up the UHC to cover all counties. I am indeed gratified that you have spent the last few days going through some of these lessons and extrapolating them to find solutions for the way forward. And so I want to assure you that my government, in consultation with all stakeholders, namely the county governments, as well as our development partners, will incorporate lessons garnered from the pilot phase, as well as international best practice, into the preparations for the national scale-up of UHC. Ladies and gentlemen, over the last 2 years, our focus has been on financing health inputs and making strategic investments in areas such as primary health care, community health services, essential medicines and medical supplies, as well as human resources to ensure high-quality health service delivery. In scaling up the implementation of UHC, we will focus on 5 major pillars. The first is what we are here to witness today, which is to scale up the reforms at NHIF, which shall be comprehensive and fully implemented to ensure that the country has a national social health insurer that is able to responsively meet the needs of Kenyans by strategically purchasing services for their health and well-being. So in this regard, today, I direct the Ministry of Health and the Attorney General to fast-track the necessary legislation that will codify these reforms into law and foster the sustainability of the fund. The second is to establish a mandatory UHC scheme which will be managed by NHIF and regulated by the Ministry of Health. And it will act as a national scheme for all persons resident in Kenya, notwithstanding one's social status. 3, adopt the Essential Health Benefits Package, which is already completed and which will enable Kenyans gain access to an essential set of health services at a much lower cost. The package covers several areas, including outpatient and inpatient services, communicable and non-communicable disease management, maternity, dialysis, radiology, minor and major surgery, substance abuse, rehabilitation, emergency services, and cancer treatment, as well as ensuring that we take care of the mental health of our people. These, among others, and we want this provided at the low cost of Kenya shillings 6,000 per household per annum. 4, in line with the clarion call of leaving no one behind, the government will provide health insurance cover to initially 1 million households who are vulnerable and unable to meet even that low-cost premium of 6,000. The identification of these 1 million households by the Ministry of Health, Ministry of Labor and Social Protection, as well as our county governments, is set to begin in a few days across the entire country. 5th, the biometric registration of the identified poor households, which we launched today, is set to ensure that beneficiaries are identified when they seek services at the healthcare facility and at NHIF branches countrywide, and an e-claim system will be used to improve efficiency and to curb fraud and abuse, challenges which we must address as we scale up. Past initiatives to improve healthcare service delivery have not been a success because of these challenges. Ladies and gentlemen, delivering UHC requires close collaboration and synergy within government, both tiers of government. It will also require greater cooperation with the private sector, our development partners, participation of the religious sector, civil society, healthcare practitioners, and support from the people of Kenya at the individual, family, community, and national levels. Indeed, as has been identified in the Building Bridges initiative, Kenyans are eager for improvement in healthcare delivery by both government and private providers. The BBI implementation report proposes fundamental and innovative solutions to the health quagmire that Kenya has faced since the beginning of our nationhood. As a government, leaders and partners in delivering the Kenyan dream, we are called upon to do all that is required of us so that Kenya can indeed be that healthy nation that we seek. The Kenya we want is one in which no Kenyan should leave the country so as to receive the medical care they require. A Kenya that is a world-renowned medical tourism destination whose healthcare bills no longer destroy in a single swoop wealth that has taken decades to create, and a Kenya where every person, regardless of their financial status, will receive the care they need at an institution within the local area, and a Kenya where UHC has become a platform for innovation in developing locally manufactured medicines and equipment. I want to thank, through you, Chair, the county governments. I want to thank our development partners. I want to thank the Ministry of Health, and indeed all other ministry departments and agencies involved in this noble national task for delivering this initiative on time and indeed under budget. In order to secure sustainability of financing for health, I want to urge both levels of government, as has been stated by Governor Oparanya, to ring-fence health sector funds to support the attainment of universal health coverage. I invite all Kenyans and all persons resident in Kenya to register for NHIF and to ensure that they remain up to date with their subscriptions. This will ensure that the fund has the necessary financial depth required to deliver on its very important mandate, in addition to ensuring that in the event of a medical emergency, the fund is able to step in and cover the paid-up member or their beneficiaries. As I conclude my remarks, ladies and gentlemen, I want to make it clear the scheme we are launching today must be a success. In this context, I urge the NHIF to ensure that the precious funds committed to its custody by both subscribers and supporters are utilized prudently with utmost transparency and accountability. Any person who attempts to defraud the NHIF or abuse its processes will be dealt with accordingly as provided for under our laws. Anyway, that's okay. Finally, it is now my humble duty to declare the biometric registration for the Universal Health Coverage Scheme officially launched. Asante. Ladies and gentlemen, I want to just close by just saying, I know we can do this. I know we have the ability to do this if we just work together. I want to urge, especially our members of parliament, don't delay us by unnecessary debates. We all know where we want to go. What we want now is to begin delivering. We want to begin delivering. Our people deserve it and they want it. And we are asking you to partner with us. This is not the time to show prowess in debate. This is the time to deliver so that our people can get this benefit that we all know has turned many households in our country into total destitution because of having to cover their medical bills. We have an opportunity now to fix that once and for all. And I am really calling upon each and every one of you to be active partners in this endeavor so that we can achieve this objective for and on behalf of our people. And those charged with the responsibility of looking after these funds, I want to promise you that if you do not handle these funds with the care and caution that it requires, some of us will go to very extreme lengths to ensure that you shall regret it for the rest of your lives. Let us be clear that we can no longer afford gameplay in this sector. We have a chance. You have heard what Governor Hassan Joho has said here about what he has managed to achieve in just that short space of time, that is saving lives. This is where we want to go. We want to ring fence this money. We want to ensure, just as we have done in education, we want to do the same in health. That the same manner we ring fence our education funds, we should now begin to ring fence our health funds and deliver for our people. Jameni, tufanye hii kazi. Hakuna kitu ingine, na itakuwa furaha sio wake, hata kwa macho ya Mwenyezi Mungu atasema kweli hawa wamefanya kazi. Mungu awabariki na walinde. Asanteni sana.
Asante sana. Niombe sote tusimame kwa wimbo wa taifa.
Beat sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
Daniel is among the over 3,000 farmers in Mwingi Central that have benefited from the smart water capture technology. This project was introduced here by ADRA Kenya, a non-governmental organization that is changing the lives of the people so profoundly, enabling them to help themselves and create a positive change around them.
We have a number of water-saving technologies that we are promoting and that the farmers are supposed to replicate at their household level.
We are Nation, Africa's independent media brand. We are committed to empowering all Africans, from the young to the old, from the curious to the educated, and from the heart of the cities to the rural areas. We are Nation. Join us, because if you want to get far, you do it together. Nation. Empower Africa.
Modernization and expansion of the Nairobi commuter rail service is underway.
This platform enables you to come in quickly and to exit out quickly.
The project aims at providing passengers with safe, reliable and affordable transport services in and around Nairobi City.
It will be a big change in the next few weeks.
Progress on the Nairobi commuter rail service project this Sunday at 10 p.m.
Oye, ango ni papa Charles papa wana nimejitwanga quarantine nikiwa na bibi na watoto ndani ya kesi yake. Kitoko tu tunalamba unga hapa tukirarua uji na mboka ninzike. Sasa shida ango ni kwamba last born rangu hamusambati. Hamelamba hand sanitizer yote bwana. Yote. Ati kwa sababu inakaa kama yogurt. Kwa kama ya findu vikholanga without your knowledge. Na ni juzi tu pia hamekula sapuni ati kwa sababu.
To get last born by audio motivation, dial star 811 star 929 hash. Skiza, non-nation.
Love garlic in your food but hate the hustle of making it? Introducing fresh fried garlic, specially crafted with garlic oil for healthy living. The oil has a beautiful garlic aroma and adds an extra kick when used on your favorite meals. Fresh fried garlic combines wonderfully on salads, stir fries, marination for meat, or simply when sprinkled on your favorite dish. Try fresh fried garlic today. Available in all leading outlets countrywide.
That's when she replied, "Give me one good reason to stay with you." Nikamtumia 100 reasons to be my boo. Akanisho unabonga sana kwa text lakini in real life when I'm timid. Hapo nika get minutes ya kupaint picture vivid. Akasema ati I'm in demand. Unadhani DM yangu ni MD? Kumbe nilikuwa nishasotiwa na 100 MB.
Call, SMS and browse from only 10 shillings with Telkom. Now that's power. Telkom, moving with you.
Africanacity is Paul Kihuha turning scrap metal into affordable film equipment. At ABSA, we love Africanacity.
This is NTV.
Good afternoon. Welcome to NTV at 1. My name is Olive Barrows. Just a few minutes ago, we heard from President Uhuru Kenyatta on the Universal Health Coverage Forum that is being held in Mombasa County. He has officially launched the scheme, which is expected to bring a raft of changes in the health sector. And he's called on the various agencies to look into ensuring the resolutions of the Health Sector Intergovernmental Forum on Universal Health Coverage are made into law. He's also talked tough on corruption in the sector. Let's listen in. All right, we are preparing that for you. But he did caution members of parliament that it would be ill-advised to debate it to death. He did tell the NHIF officials that they would regret it if corruption cost Kenyans universal health coverage. Kevin Mutai will be filing a more comprehensive story for us for our later news bulletins. Now, another trending subject matter is Sports Pesa. We have Ida Waringa in studio. Ida, the betting licensing board had a press conference earlier today. What did they have to say on the subject?
Exactly that, Olive. Just to give you a bit of context on the situation, well, after a year and 4 months of SportPesa operations in Kenya being, practically zero, of course, they did pull out of the market in the course of 2019. Well, last evening, there was a huge development both on the SportPesa social media pages as well as SportPesa CEO Ronald Karauri basically saying, look, SportPesa is back. An interesting few words in his tweet, Olive, were quote unquote that SportPesa is back under a new BCLB holder. Quite interesting. And of course, as a result of that, this presser this morning that you've just mentioned that was called by the government in, of course, liaison with the BCLB, that being the Betting Control and Licensing Board. It's a huge technicality, and it's because under the new BCLB holder, well, that is known as Milestone Gaming Limited. Here's the trick, though, that Milestone Gaming Limited already were launched under their own trading name known as Milestone Bet under the current financial year 2020-2021. So now Milestone comes in and of course now wants to be known under the trading name SportPesa, which technically belongs to Pevens East Africa and SportPesa Global Holdings Limited. That is basically, long and short, what the BCLB has said is totally not possible, and as such they have revoked, and basically SportPesa are down again. Now, talking to a few sports bettors in the course of today, they did confirm that the SportPesa website, pay bills and what have you, came into operation last evening. People even opened new accounts, Olive. People placed bets on the weekend games, and then all of a sudden this morning, after the latest BCLB and government action, that website and pay bill numbers are closed again. So of course much more on this in terms of a comprehensive report much later on, but that is the latest as of now.
All right, thank you, Ida. Oh, the controversy. All right, related to that, many people relied on gambling to support their living, and the cost of living in the month of October rose slightly on account of the rising cost of food. The Kenya National Bureau of Statistics reports that the prices of food went up by 5.75%, leading to many Kenyans feeling the pinch of inflation. Goat meat reported the largest price increase in the 12 months since October last year at 2.59%, followed by beef at 2.39%. This comes as the president seeks to begin to reverse some of the COVID-19 relief measures effective December 31st, 2020. The Kenya Revenue Authority has maintained that the recent tax laws that were nullified by the High Court will not affect its revenue collection. Through a statement sent to newsrooms, KRA says that the move by the court to suspend the implementation of the court order for 9 months enables the enforcement of the new laws. The nullified laws that relate to tax administration include the specific amendments to the Tax Laws Act, the Statute Law Miscellaneous Act, and the Finance Act, all of 2018, among others. The High Court ordered the suspension of 24 laws that were enacted without the input of the Senate, but temporarily suspended the implementation of the order to allow the Speaker of the National Assembly and the Attorney General to comply with the requirements of the Constitution. Weather forecasters in Baringo County say that the light rains in the county will persist for the next couple of weeks and give way to a drought that will last until May next year. The prediction was made by both traditional and scientific forecasting methods at a meeting convened by the Kenya Meteorological Department. Charity Monkey reports on the intricacies of traditional weather forecasting that is seeking to gain legitimacy.
Men gathered around a goat armed with a knife is a definite sign that the life of that animal is about to end. It is not a party or any ceremony of social significance. Believe it or not, the men are looking to read the weather patterns.
To us, we are seeing only meat. But to some people, they see more than what we are seeing.
The body part that holds the mysteries of the skies is the intestines. The reading has to be done by at least 2 people to ensure that accuracy is achieved.
Mwaka ujao mvua bana iko karibu sana, hata mwezi wa 4 kuna 5, labda mwezi wa 7 au mwezi wa 8. Kwa hivyo sasa hata vile nyota anasema mwaka ujao ndio itakuwa kiangazi kubwa sana.
Sasa masomo kidogo ndio nasumbua watu kusema mambo ambayo wazee wanasema si ya Mungu, hapana, ni ya Mungu. Hata tukikuta digidigi tunajua ni nini natokea mbele. Tukikuta sungura akitutangulia tunajua ni nini. Na hata Biblia anasema ulisa wanyama.
The traditional reading of the weather was done at a meeting where traditional forecasters met with scientific forecasters from the Kenya Met Department. And as strange as it sounds, the modern and traditional results mirror each other.
We'll continue to experience a moderate rain toward the end of December, but now coming towards the beginning of the next year, we'll now experience a longer season of drought.
And it's not just the weather that the intestines of the goat predicts. Looming outbreaks and calamities are also read here.
Mtu mkubwa amefungwa na nyoka. Yani damu na makika kabisa.
And so what this means is that Kenyans should brace themselves for a drought come next year. Already the World Meteorological Organization has issued a La Nina alert that will affect many parts of the world, including Kenya. Charity Mwangi, NTV.
I think I'll have to visit the NTV Kenya YouTube channel to wrap my head around that one when they post it. Away from matters weather forecasting using animal intestines, Tanzanian President John Magufuli won a resounding election on Friday with 84% of votes in a poll his main rival said was riddled with irregularities such as ballot box stuffing. Magufuli's main challenger, the Chadema party candidate Tundu Lissu, won only 13% of the vote after denouncing widespread fraud, intimidation and oppression of the opposition. Voter turnout was 50.7% from more than 29 million voters, with over 260,000 votes declared invalid. No final results were given for the parliamentary results. However, Magufuli's ruling CCM had earlier won all but 2 seats, with around 264 parliamentary seats announced. In 2015, Magufuli won with only 58% of the vote. The resounding victory in Wednesday's vote will further cement the power of a party that has been in power since independence in 1961, but stands accused of a slide into autocracy under Magufuli. Lissu, who returned to Tanzania in July after 3 years abroad recovering from 16 bullet wounds sustained in an assassination attempt on Thursday, declared that the results coming in were illegitimate.
Kupitia Chama cha Mapinduzi CCM, ambaye amepata kura nyingi halali kuliko wagombea wengine, amechaguliwa kuwa rais wa Jamhuri ya Muungano wa Tanzania na Mheshimiwa Samia Suluhu Hassan amechaguliwa kuwa makamu wa rais wa Jamhuri ya Muungano wa Tanzania, naye kupitia Chama cha Mapinduzi CCM katika uchaguzi wa rais uliofanyika tarehe 28 mwezi Oktoba mwaka huu.
I suppose I should say cheers to John Pombe Magufuli. We take a break on that note. We'll be back with the sports news.
I wish I could have soft and glowing skin.
New Geisha Black Soap with activated charcoal to give you soft and glowing skin. New Geisha Black Soap and New Geisha Moringa.
Maji mdosi wangu ametupa simu yangu ndani ya maji.
Mdosi wako kwa sawa. Venye Nkirota ameniambia ajui na akimpigia simu ashiki. Hi, guy, what?
For the women who deserve more, Moped is now in Kenya and more than 40 countries. With its nylon-free surface, new Moped has unique softness and up to 100% protection. Your skin will love it.
Ita, ingia timu kubwa uache kulialia kila saa. Unaona hizi zawadi? Hizi ni redemption za Crown Paint kwa timu kubwa. Kuingia timu kubwa ni rahisi sana. Unachohitaji kufanya ni kudownload app kutoka Play Store. Haya sawa. Ushaingia ndani ya timu kubwa. Haya.
Pata points kwenye timu kubwa Painters Loyalty Program, kisha zibadilishe hapo bila delay na upate airtime, electricity tokens, home appliances, Naivas shopping vouchers na zawadi nyinginezo. Unangoja nini? Download timu kubwa app kwenye Play Store ama tuma SMS kwa 20543 na ujipange na timu kubwa. If you like it, crown it.
Sona moja imetengenezwa kwa njia spesheli ili kupambana na maumivu kwa haraka. Sona moja ina aspirin kama kiungo. Sona moja, kitulizo kamili. Maumivu yakizidi, pata ushauri wa daktari.
Thank you for staying with us on NTV at 1. Keeping focus on the AFCON qualifiers and with a little more than a week to the national team's home match against Comoros, former Harambee Stars striker Maurice Sunguti, who was part of the team that qualified for the 2004 AFCON finals, believes that the team is more than capable of taking on the island nation.
Kwa kweli mechi itakuwa ngumu, sio kwa Harambee Stars peke yake, pia kwa Komoro, maana hii COVID imeaffect nchi dunia mzima. Kwa hiyo siwezi sema Komoro kwa anafanya wanajiandaa vile Komoro hajiandai, pia sisi tulikuwa tujiandai. Lakini vile ninavyojua kama Harambee Stars tulipata draw kucheza na Misri, tumepata draw na Togo. Nina matumaini kwa hiyo mechi tunacheza na Komoro, nina uhakika tutapata ushindi. Unajua football inaanzia pande ya defense. Ukiangalia mchezaji kama Origi ni kipa mwenye uzoefu mkubwa sana. Amecheza miaka mingi, alafu amecheza mpira wa kulipwa nje miaka mingi. It's a good timing kwa yeye kurudi, maana analeta more experience kwa team. Then ukiangalia pa makipa wengine wote wakina hiyo Teno, wengine wote ni makipa wazuri. Nasema pale competition niko mzuri sana na Ghost atakuwa na kibarua kigumu sana kuchagua first goalkeeper. But niko sure mwenye atachaguliwa kuwe mlinda lango siku hiyo, najua atafanya kazi mzuri.
And that concludes NTV at 1. I will see you on NTV Weekend Edition tonight.